Cancer Survivorship Programs celebrate those who have survived, inspire those recently diagnosed, gather support for families, and help create awareness for the challenges of cancer. Joining us today, we're excited. You were my first request when we started talking about Breast Cancer Awareness Month. We have oncologist and medical director for the Sanford Cancer Survivorship Program, Dr. Shelby Turstrup. Thank you for coming in today.
Thanks for having me.
All right, a big month. We're talking in the break. It's the last week of October, but still so much to talk about. And really, we should be talking about this all year long, not just in October. But let's start with, what is Cancer Survivorship? What is the program, Cancer Survivorship Program?
Yeah, well, I mean, cancer treatment is such a small slice of somebody's life. And so cancer survivorship is really what happens after that. You know, how do you, reduce the side effects of cancer treatment? How do you live a healthier life to prevent cancer from coming back? And how do you prevent a secondary cancer? And how do you help your family and your support system cope with the diagnosis as well?
It affects a lot of different things. Can you talk a little bit about some of the top priorities of the survivorship program?
Right. So we're so excited for some of the newest programs that we've developed. We were a recipient of a large CDC grant, and so that has helped us to be able to form some of our newest programs. One of them is called the CLIMB program, and that program is a collaboration between our psychologists and our child life specialists, and its goal is to try to help prevent the kids of parents who are diagnosed with cancer having a traumatic response from that cancer diagnosis, so that we hopefully help prevent psychological and emotional problems and behavioral problems for these kids whose parents have been diagnosed with cancer. So that's been one of the greatest programs that we've started lately. We also have a fertility navigation program that we recently started, and so this is a nurse who bridges between the fertility specialists and the oncology team to help improve the odds of having children after cancer treatment. And then last, one of the other exciting programs is called an integrative program, where we teach patients how to reduce their stress response going through treatment and after treatment, to both improve their quality of life and also improve and prevent recurrences.
I feel like from day one when I first interviewed you, the quality of life has been huge for you. It's not just about the cancer diagnosis, just about the treatment of the cancer. It's such a bigger picture for you.
It is such a bigger picture. I mean, we of course want to cure the cancer, but ultimately people have to live beyond that cancer diagnosis. And so how do we, and we're excited because we're to the point where we are getting so many cure rates that we can actually think about that and focus on that, and how do we reduce the amount of treatment people have, and how do we help them live better.
Okay, and I love that the children are involved in this. I would have never even thought, but it makes sense. But it's great that you have a program to help.
Yeah, we're so excited about that. I think, overall we're learning so much about traumatic responses in children and how to really change the course of a child's life by intervening. And so now I've been an oncologist here for about 15 years, and I'm seeing these children grow up. And it's one of the strategies I'm really, really excited about.
And life going on after a cancer diagnosis, after beating cancer.
Right.
There's so much more that you can do now than you used to be able to.
Yeah, exactly.
So let's talk a little bit too as to what kind of treatments are done and advice, going back to the actual treatments. Any updates, any cool new things that you're happy to say that you're doing here as far as treatments and helping people get to those? You're having much better rates than we did 10 years ago, 20 years ago.
Well, I think one of the greatest advancements is there's two of them, I think, in my mind, is really a personalized medicine approach. And, I'm a chemo doctor, and so when we can reduce the amount of chemo based on that specific person's tumor, that's a win for us. So when I get to say you don't need chemo for your breast cancer, that's exciting for me. And we do that by looking at their tumor, and we send it for genetic testing, which used to take years to be able to do, and now they can do it in an hour and get us those results, and we can say, no, based on our data, we know that you don't need chemo, or we know that you do need chemo. And that's pretty exciting, because that's ultimately how we really reduce side effects.
And we have talked about that. We had people come in and talk specifically about genetic testing. What a great tool that you have now at, a lot faster, the results a lot faster than you have in the past.
Yeah, so we have genetic testing on people's blood to look at their families and what can be passed down generation to generation. But we also have the actual genetics of your tumor.
Any other advice for people as they're listening right now, and we're talking so specific to once you have the diagnosis, any advice for just women who are thinking, I don't know, I maybe did the genetic testing, I know I'm at risk, but what should I be doing to try to live a healthy lifestyle? When we're talking about women's health.
Yeah, women's health. I think that it's very similar to what we talk about all the time, but 150 minutes of moderate activity a week, really sweating and lifting weights 3 times a week. We want you to eat calcium-rich foods so that we protect your bones. We want you to drink as little alcohol as possible. Apply sunscreen, do your prevention testing or your screening testing, and then really find your MOA, your group of support system, your women who support you to help ease your stress and help you live a happier life.
Well, thank you so much for coming in today. And if you want more information on the survivorship program, of course, we will add some links up on our North Dakota Today Facebook page as well. Always great to visit with you. Thank you so much for coming in today.
Thanks for having me.
Stay with us. Coming up on North Dakota Today, a new series on Netflix has a lot of people talking about the dangers of emotional domestic abuse. We're going to break it all down for you next.